Welcome back to our conversation. We're going to be talking in the fraud and abuse unit about the compliance program. And the reason that I couch it in these terms is that your readings will provide a background on the specifics of fraud and abuse regulation under multiple different federal statutes and a few state statutes. We'll be focusing in on fraud and abuse as it really rubber meets the road. And the biggest of those, of course, has to do with the billing and coding section. And that is almost always where one gets crosswise with the federal government for a federal program of Medicare, Medicaid, of how care is being billed to the federal government. It may also become an issue for billing to third parties, such as Anthem, Aetna, whoever, of how you're billing and coding patient care. The second big area for fraud and abuse prosecutions is the contracts and relationships that a healthcare entity has with others. That may be a hospital relationship with a physician. It may be a landlord-tenant issue, quite unsuspectingly, that a hospital or a healthcare system owns office buildings where physicians are located, and the amount and terms of those contracts are not fair market value. So those pop up from time to time. It may be the relationship between an ambulance company and a hospital. It may be the relationship between a healthcare provider and a DME provider. All of those are fraught with being questioned under the fraud and abuse guidelines. And last but not least, of course, are the marketing practices. And this is particularly a hot button issue in the DME market and the what's called the disposable market, even though it usually falls under the DME category, of how one advertises to patients to buy their products. It is not unusual to see advertisements saying that this product is free, when in fact it is only free to the patient in that they aren't paying for it. It's being billed to the federal government. And how one goes about marketing that is tightly regulated and is fraught with opportunities to get crosswise with the federal government. So let's look at compliance programs. They're vitally important in the healthcare administration. We'll first look at model guidance programs, then we'll look at the essential elements of a compliance program, and then we'll focus in a little bit on how a physician's office would implement this work. So the federal government has promulgated numerous model guidance programs for healthcare providers. They started out with clinical labs and have worked their way through a number of different settings, and this was the list as of about 5 or 6 years ago, so I'm sure they have lots more out there as of this conversation. What are the essential elements of a compliance program? Well, we will hit on each of these topics in more detail in just a moment. Let's first look at the written policies and procedures that a compliance program needs. Starting point is a code of conduct for your staff. This may be as specific or as broad as you want it to be, but it needs to be really a statement of what you expect and how your folks to behave. Then you're looking for developing policies and procedures specifically for primary exposures, and that depends on what organization you may be running. But certainly documentation is a hot button area. The medical necessity documentation, particularly if you are in a nursing home or a DME setting. Coding is an important area, as is claim submission. You have to appoint a compliance officer, and that should be someone that's high ranking in the organization. There's a great deal of debate out there as to whether a compliance officer should report to the general counsel, or should they report to the CEO, or should they report to the board of directors directly. No great consensus on that. You'll see in many organizations that the compliance officer reports to the general counsel. There are pros and cons to that we could spend an entire course talking about. The key is, though, that the compliance officer must be able to affect change. It's not just somebody who is out there baying in the wind. That person has to have the authority and the ability to actually change bad behavior. Therefore, people have said that those who are focused on this deal with recommending that the compliance officer reports directly to the board of directors in your organization and not to the in-house counsel or the CFO. Let's turn our attention to educational programs. This is an important component of any compliance program in that when a new employee comes on, they are properly oriented and trained in complying with whatever regulations and statutes may be applicable to their position. There is also has to be ongoing and remedial training that this person is, given continuing education on whatever pace is appropriate, whether that's quarterly, semi-annually, annually, on not only to refresh their knowledge, but to make them aware of any changes that may be occurring. This might be face-to-face, this might be online. There's obviously many ways to undertake educational programs like this. Documentation that proficiency has been gained is very important, and that is why many of the entities that I work with have gone to online formats, which have self-assessments built into them. It takes care of the documentation. You aren't running around trying to find where that paper test is, where the sign-in sheet is, all that sort of thing. Next, let's turn our attention to communication, and that is one of the biggest challenges in a large organization, obviously, is that you have to develop a culture of compliance, and that everyone is doing the right thing because it is the right thing to do, not just because they have to or they're not getting caught, and it comes from the top. So it's important that the entire organization really put forward that they are wanting to be a compliant organization. Employees have to be comfortable reporting any deviation either by themselves or by a unit or in a system that is out of whack, that may be non-compliant with the regulations and laws that are applicable. When there is a problem that's discovered, then you have to have an effective scheme in place to deal with it. And that has to be starting from the front of have you appropriately screened all of your employees through the NPDB or through the cumulative sanction report, through basic background criminal checks, whatever may be pertinent to the position that you're looking to fill. When there is a problem that's detected, your action needs to be swift and public to address it. And that can be very difficult, obviously, on a practical basis. It may be a key employee. It may be a very well-liked employee. You may have given awards to that employee for their success in their position, and now you're going to fire them because they have crossed the line. Not easy to do by any means. Let's talk a little bit about monitoring and auditing. Part of your compliance program has to be, how are you going to keep an eye on what's happening? There has to be a purpose to it, and that purpose has to have a good compliance program has two different purposes. One is it's designed to detect any wrongdoing, and so for example, you're going to be auditing to make sure that the coding is compliant. You're going to be looking at records to make sure that medical necessity is documented, that sort of thing. You also want to make sure that it's a deterrent effect, so you don't want it to be running entirely in the background. You want to make sure the employees know that there is this program going on out there, because it's much better to be deterring the behavior than trying to catch the behavior. Different places to be looking at it. One is sort of a baseline of on the front end, making sure that your employees and your systems start out on the right track, that they're compliant, that they address the problems that are foreseeable. And then periodically going back and looking to assure that in fact you are hitting the target, And then, of course, there's always the complaint-driven investigation that either a patient has come forward and said there's something wrong with their billing, an agency or an insurer has kicked back billing or has advised you that they're undertaking some sort of effort to examine a problem. You want to get ahead of that and do your own internal investigation as quickly as possible. When you respond, to complaints or audits, you want to make sure that you're on top of it, that you're moving quickly. You want to make sure that you're not going to have this problem repeated. Sometimes you can't put the genie back in the bottle, but you don't want the genie showing up again. And so you want to make sure that your folks are educated on the point, that the systems are improved since that is often the base of the problem. Your employee may be a good employee and they were doing what they thought was right because your incentives and your targets steered them towards that. And certainly at some point you may need to sanction your employees anywhere from putting a note in their file to terminating that employee, depending upon what the nature of the problem is. So how does a doctor going in a solo practice, for example, go about doing all of this complicated stuff? If you're a large, HCA, tenant, whoever, running a integrated healthcare system, you have a whole staff that does this sort of thing. But if you're a doctor out there by yourself and you're doing the books at night by yourself, A, that might not be a great idea to begin with, but B, how do you go about doing a compliance program? Um, you, to the extent possible, you can develop your own in-house sort of expertise. I mean, if you have an administrative person that runs your practice, making sure that person is well educated on what the proper parameters are and has the almost the accounting sort of safeguards in place for you to be able to double check the compliance. But you may also want to make sure that you outsource much of the compliance program. You may want an outside practice administrator to come in and audit your practice every year to make sure that you have the right systems in place, that your coding is on the right basis, that medical necessity is getting documented, whatever elements your practice may be exposed to, that is being run in your office. That brings us to the end of our conversation about fraud and abuse and compliance programs. It obviously is a large subject that every healthcare institution needs to be on top of, and I encourage you to dig deeper, particularly if you are in one of the administrative areas that is involved in compliance, but also if you are overseeing any area that has to do with interactions with outside providers.